All right, my name is Hailu Tilahun. I'm a cardiologist, a general cardiologist at Virginia Mason, downtown Seattle, and Bainbridge Island Clinic. In terms of my interest in cardiology, essentially at the core of it, the heart is a pump with, plumbing in terms of the blood vessels. So it's a lot of conceptual questions that come up, and there's a lot of problem solving involved in it. So I like that aspect. And then in addition, in cardiology, you can work with patients, 20, 30, 40, 50 years in clinic, or you can meet people, when they are in a more acute setting, the emergency room and the intensive care unit. So it kind of covers a breadth of clinical experience. Things like coronary artery disease, so potential blockages in the blood vessels, heart rhythm abnormalities, commonly, things like atrial fibrillation, if there is heart weakness. And then another big part is also preventing any of these conditions from developing in the first place and lowering kind of the risk of heart attack and stroke. So I deal with the preventive cardiology side of things too, as well as treating conditions that come up. I have been involved kind of, for the last maybe 7 to 10 years more in international health and also how to deliver care in a kind of resource limited settings, whether that's locally or internationally. So that's kind of it has been my research interest. I think, really it's working with patients, because with each patient, it's a problem you're trying to solve, and you're trying to solve collectively, because obviously each patient is different and you can't have just one way that's going to work for everyone. But that also means kind of you need to know the evidence pretty well to be able to apply it in different ways. So I think, to me, that problem solving while working with people is what's kind of the most interesting of day-to-day work. Absolutely, on a daily basis. I think I'm always kind of fascinated by how people even accept the condition they have, and then just continue to work on it to improve different things. And even the fact they have trust in someone they just met, me as the cardiologist, and being willing to listen and kind of go through the whole process. So I think it's very impressive to see that. And a lot of people have a lot more resilience than they actually realize. I think the first part is listening. Obviously that gives you an opportunity to understand where the patient is at and what their preferences are, so that's key. And then communication, and obviously providing all the information you have, so they can be a part of that decision-making process, and giving people options too. So it's not just one option, or so that people don't feel like they're limited in what they can do. And I think that allows patients to have more ownership of what's going on. I think medicine is a team sport, so I think it gives you the opportunity to work with others and kind of come up with probably the best solution for that patient. And it's also there are different angles of approaching a potential problem or lowering the risk for whatever it is. And when you work as a team, you can come up with better ideas. So I think that's probably a way that really can benefit patients. For me, it's fairly clear. It's a place that emphasizes quality and care delivery with the patient in mind at all times. And then that means you're going to continually improve as a physician, as an individual, and as a team. And so that's the best place to work at. Yeah, I'm a big soccer fan. I've probably played since I was 4, so it's something that I do a lot. So I like to play soccer. I like to watch soccer. I like live music, so whenever I'm free and that's available, that's something I do. In terms of kind of more work-related, I've done a lot of international work, so that's kind of my interest, kind of helping out in clinical settings, and then also more locally in areas that are maybe a little bit kind of resource limited settings. So that's something I also do. And it's great to be a part of a bigger mission like that.